The disaster proclamation has allowed us to create a command center structure at PEMA, bringing together all the health and human service agencies, as well as public safety and law enforcement, where we have one integrated program. And it serves as a catalyst for all of us to work together and to continue to battle the opioid epidemic, which is by far the biggest health crisis that we have in Pennsylvania. You had asked about neonatal abstinence syndrome. So these are infants born of mothers who had been using opioids, either prescription opioids or heroin, during the pregnancy. And so when they're born, these babies go into withdrawal. There are some specific treatment protocols that the pediatricians have to treat those babies. And so we have a work group run by the Department of Human Services, but including the Department of Health, Department of Drug and Alcohol programs, and a number of other agencies on how to deal with the substance use addicted baby. And the most obvious one in terms of this is neonatal abstinence syndrome. And so we have published actually treatment guidelines for the opioid addicted pregnant women, which was taken to the Department of State for their affirmation and acceptance. And through the Centers of Excellence as well as the PAC-MAT programs, we really have a excellent treatment paradigm for these mothers and then the babies. Probably the best program that has served as a template for us is the one at McGee Women's Hospital in Pittsburgh. And so with another round of 21st Century Cures funding, we're hoping to even have more services for those mothers, and through the disaster declaration and getting better data from hospitals to be able to help those families in all different aspects.
So far since the declaration in the last 2 weeks, do you have any data that you can share with us?
So the data that came out last week through the Prescription Drug Monitoring Program interactive data set is the most recent data that we have. It does give data about overdoses from the county coroners, and it also gives us a picture in terms of prescribing trends for opioids in Pennsylvania. And in the last year, we have decreased the prescriptions of opioids up to 13%. We have virtually eliminated doctor shopping, where individuals might go to multiple providers to either get prescriptions for or to obtain opioids. But we still have more work to do on all of our fronts.